Welcome to another great Yankee Dental panel, or if this is your first, thanks for choosing us to be your first. I'm Matt Simcoe, brand manager for 42 North Dental, and today we're giving you an inside look at a DSO during a pandemic. We'll touch on the current dental industry, practice valuations, patient demands, how we're facing challenges in staffing and recruiting, along with much, much more. I'd like to introduce the subject area experts of 42 North Dental. We'll start with Jeff Ligabell. He is president and CEO of 42 North Dental. Dr. Michael Shalava is here. He is the vice president of clinical affairs for 42 North Dental and a member of the board of registration in dentistry in Massachusetts. Greg Wappett, he is 42 North Dental's senior director of corporate development. Kirsten Von Hassel, she is the director of marketing for 42 North Dental. And Priyanki Amroliwala, she is senior manager of talent acquisition for 42 North Dental, and perhaps the best title in the entire organization. I'd like to jump right in with Jeff Ligabell and start off the conversation with talking about how 42 North Dental specifically has risen to the challenge of the unprecedented times we're in.
Well, we've certainly tried hard, and nothing about it has been easy. I'll say that. You know, to say that it's been an easy year or an easy challenge would be a ridiculous statement. I think what I would say is we've done it as a team, first and foremost, and we really came together as a team. And in the profession of dentistry, safety has always been a priority. In this environment, it became the priority. And so we really came together as a team to try to figure out how can we make safety our priority. And it involved a lot of effort from a lot of people, starting with developing brand new protocols for how to see a patient in a dental practice. It involved everything from making sure that we had social distancing in the practices, you know, developing screening questions to go through with patients before they enter the facility, limiting family members joining appointments, having people wait in their cars, just really a completely different workflow for patient visits. And it really needed to be very well thought out, very well documented, and trained to all the practices to make sure that we could see patients safely and keep both patients and staff members safe. On top of that, there's PPE. We, prior to 2020, had never talked about N95 masks. I think everybody's tired of hearing about N95 masks, but we spent hundreds and hundreds of hours identifying the proper PPE and finding the proper PPE, which was, as everybody knows, very challenging, especially at different times during 2020. With N95 masks, you have to have fit testing done. We did that for all people. Everybody was fit tested for N95 masks, which was a very large logistical effort, but something that we thought was critical to make sure that we were keeping people safe. So I would call it a massive team effort focused on safety and making sure that we could continue to safely provide great care for patients in a very difficult environment.
I mean, it sounds like a massive effort when you talk through it all, and I know it seems like a whirlwind in the past 9 months. And there's over 80 42 North Dental practices at this point. And with all of those different points that you talked about, safety, PPE, making sure people were fit tested, what made the 42 North pandemic response successful? Because the company managed through, continues to manage through, and continues to be successful.
I hate to go back to the same topic. It was the team. We have a great team. I'm proud to have a number of our great team members on this call. We have a lot more folks that we needed everybody to really pitch in. So we have a lot of resources. At times in 2020, it felt like we didn't have enough resources. I think it would have been impossible to feel like we had enough resources when we were trying to develop some of these protocols in a very short period of time when we're trying to find this PPE. But we have a lot of resources. We have a lot of great people that really care. about patient care and about the people working in the dental practices. And we really came together as a team. There was a lot of planning that went into it. It was not a shoot from the hip type of exercise. There was a lot of planning that went into how to do this appropriately. And then it's about communication. And I would say communication is one of those things I'd look back and say, what did you work really hard at? Communication. What could you have done better? Communication. It's impossible to communicate enough and well enough to a team of now over 1,300 people what's happening on a daily basis. But we put a lot of effort into trying to make sure we were communicating appropriately and effectively with the entire organization.
And that's a really good point to touch on with Kirsten Von Hassel, the Director of Marketing for 42 North Dental. And you led basically the communication charge throughout the organization. And how important was that effective communication in all areas of the business, staff, patients, potential patients, and otherwise?
Thanks, Matt. Yes, communication is always very important. And I partnered with my colleagues in HR who really handle employee communication, and I focused on patient communication, and we really worked together. As the pandemic started, there were a lot of immediate needs. As Jeff talked about, getting those health and safety protocols in place, making sure that the fit testing was done. So we really worked hard to support that and to help organize that. There were also immediate patient needs because we have very busy practices with very full schedules, and we had tons of appointments coming up every day. And as we were, working with the state and figuring out what was happening, we had to communicate with those patients to make sure they knew what was going on. As the pandemic unfolded, if we stick on patients for a moment, the needs changed from kind of those immediate needs to things like emergencies. What are patients going to do? It's fine to say, put off your appointment, but what if you have an emergency? We certainly didn't want to send those folks to the emergency rooms when the emergency rooms were busy with, actually dealing with COVID patients, especially here in the Boston metro area where we had kind of some of the first outbreaks. So we actually did something really that I'm still very proud of. We took our phone technology, which was a new virtual system that we had invested in. We were able to build a virtual call center that we could staff with people working remotely to handle and triage patient emergencies. And it worked really well, and we ran it 24/7 for all of our practices. And I think over the course of the pandemic that we actually fielded over 9,500, I think, calls, and we got them to the appropriate place and kept them out of the emergency room. So at the end of the day, that's everyone stepped up from all across the company to man that call center to make sure that patients that needed help got help.
I mean, that's a very significant number, over 9,000 patients that were communicated with. And I would think, thinking back to what Jeff said earlier, that it's the people and the teams that really make that possible. And Jeff, do you think that that is the differentiator between DSOs? Is it the teams? Is it how they step up? Is that what makes each one of them uniquely individual?
Yeah, I guess I would say I'm certain, or I know that there's a lot of independent dental practices that stepped up in a big way during this time. I think, to Kirsten's point, we essentially mobilized resources from other areas and developed this sort of inbound call center to handle these emergencies almost overnight. And because of being a larger organization like we are, we were able to put together enough resources that we essentially answered the phone calls for all supported practices, even when they were advised to shut down for a period of time early in 2020. So we were able to not leave any patients in a lurch. We were able to answer calls, and I do think without resources, that's hard to do because you essentially need to have kind of full people working full time, even while a practice may not be seeing patients full time, which is challenging. So I do think the availability of resources, the ability to deploy resources in different ways. We had some folks who work at front desk in practices, taking these calls. We had some folks that do training for our practices taking these calls. So we pulled people from a lot of different areas to make sure that we were taking care of our patient base.
And it was nearly 24/7, correct me if I'm wrong, right? Those phones were being answered and patients were being responded to.
Yep, absolutely.
Yes, we kept, oh, sorry, Jeff. We did keep them open Saturday night, Sunday mornings. I did some shifts. People around the company did shifts. I learned an awful lot about dental emergencies. As a non-clinical person, it was pretty eye-opening. And I think also one of the other ways we were able to help patients is that we do believe really strongly in a multi-specialty model. And so we do have access to periodontists and endodontists and oral surgeons. So we were really able to help patients with a complex array of emergencies. And not just our own patients, we did get calls from, folks we'd never seen before who were really in a bind, and we were able to help them out as well. So we all felt really good about that initiative.
And touching on that clinical aspect, Dr. Shalaba, I want to jump over to you. Tell me a little bit about the steps that were taken early in the pandemic from a clinical standpoint.
Thanks, Matt. Looking back, the first thing we did was we leveraged our clinical management team. And our clinical management team is a group of clinical leaders that we meet 8, 9, 10 times a year to talk about clinical protocols. And it was just amazing how we were able to come together in late February, early March, and start to tackle the problems that we were facing. We looked at, number one, when the ADA gave the guidance to close dental practices except for emergency care, we looked at defining what was emergency care. We came up with our own definition prior to the ADA publishing theirs, which was important because it gave direction to our providers internally to allow us to determine what patients needed to be seen. From there, we also looked to identify, I'll call it emergency hubs. So we were able to continue to work with that call center to steer patients to locations that were best serving those patients. What was so important about that is that we were able to triage care and get patients to be seen closest to their homes as much as possible. We identified providers who were wanting to and willing to come in and help during the pandemic. So that identified specialty care, specifically endo, oral surgery, basically operated as if there was no changes because a lot of that care that they provide was emergency care. GPs were covering emergency care as well, but the hubs that we set up helped triage those patients and get them to stable conditions. From there, we also identified what was most important. When the ADA put out their statement to close except for emergency care, people were concerned about how safe it was. And there were a lot of ancillary products out there that had no clinical scientific research done behind it, that were making claims that were unsubstantiated. And what we were able to do is we basically put our heads together and said, what do we need in order to practice? And that was the highest level of PPE. So we went out and secured N95s as early as possible. We secured face shields and gowns. I think we purchased over 8,000 brand new gowns that were basically washable, that had the highest level of PPE standard. And making those commitments and being able to deliver that PPE to our providers, secure the safety that they felt they needed, and ended up being substantiated by the CDC that was needed for them to practice. So I think at one point we made a purchase of 40,000 N95 masks. And what's amazing about that, at the same time of being able to make that purchase, if you went out on your own and try to purchase 100 N95s, it was impossible. But being able to work with our vendors and leverage those established relationships to purchase huge quantities of the items needed really allowed us to provide a safe working environment for our employees, and also for our patients.
And that's the power of the DSO, right? To have that leverage and to have those deep relationships.
Absolutely. Understanding, ahead of time what is available, what's not available. Working through the last couple of months, there was a shortage of gloves. And working with our vendors, we were able to secure an abundant number of gloves to make sure that we and our staff and our patients are protected. It's really I had been quoted previously in a couple of journal articles that it was the Wild West of procuring PPE, and it was. The first couple of weeks of March and into April, it was crazy. And what I mean by that is, we didn't have our headquarters opened, so we didn't have all of our offices open. How are we going to get the PPE to the locations? We were using my garage. I was getting shipments to my garage, and then we were having teams drive the PPE to the individual offices that were still open. So, we became a distribution center, and we were not in that business, but we were able to make it happen and make it work, because when you're in a crisis, you do what you have to do.
And even in this short time we've been chatting, from each person that's spoken, we've talked about collaboration, communication, and the teams. Dr. Shalaba, how would a single dentist have done this? Someone who's in the practice by themselves, when they don't have a clinical management team, when they don't have a bunch of resources to redirect somewhere else or become a distribution center, was it nearly a insurmountable challenge for a single dentist?
I think it's very difficult. And I think what we saw was a lot of people were buying product that was not certified or not substantiated, that was real. So we've heard stories of people getting KN95s that looked like coffee filters. And, I've seen them. I've dissected them, and they weren't 5 layers, and there was no certification. We didn't know where it was coming from. So there was a lot of gray market and black market product out there that was available that, unfortunately, people bought something that wasn't what they thought they were buying, and because that was what was available. So I think that, being able to be above that and being able to work with legitimate vendors and securing the PPE that was needed to reopen across the board. So we went from having our 10 hubs to opening up all of our offices once we hit late May, early June, when the states gave the okay to go ahead and open. So it was imperative to constantly secure the PPE that we needed to open up. We're in multiple states. Every state has a different set of rules and regulations based on to allow you to open. So working through those regulations, getting our offices up to speed to meet those standard requirements, and understanding them was a process. And
the idea of just having someone having your back, to have a dentist and employees and future employees understanding that a DSO like 42 North is there to have your back. Jeff, how does that continue to position 42 North or DSOs in general to continue to lead the dental industry, and for 42 North to be a leader in the Northeast and lead that community throughout the pandemic?
I'm chuckling as I hear Dr. Shalaba talk, because I'm picturing a couple days back in the spring when he and I were loading N95 masks and face shields and gowns into his truck, and I joked with him that the inventory in his truck was worth about 2 to 3 times what his actual truck was worth. And I can picture he and I having a laugh about that, as well as I delivered some PPE to one of our recent affiliations, and they were really joking about we didn't expect the CEO to show up with a carload of masks, and it was a recent affiliation, so they got a kick out of that. But it was that team effort. I think, Matt, to your question about how have we continued to be a leader, I think the first thing, which we've already talked about a lot, so I won't go in a lot of detail, but we really viewed that it was our responsibility to continue to provide vital dental care to the communities that we serve. And as the leading and the largest dental organization in the Northeast, at the time, we were supporting 76 practices in 5 states. And that's no small task to figure out how to do that. And what we were able to do because of our scale is we were able to have a geographic hub office in each location where we could see patients from surrounding practices. So that call center we talked about earlier, we were able to route patients to a nearby practice and get people the care that they desperately needed and keep people out of the ER. And we got a lot of phone calls from people desperately looking for a dentist and not being able to find somebody to take care of them and not wanting to go into an emergency room as they were in pain, and really relieved that we were able to take care of them. So I think that's the first thing that we took very seriously, to be that leader in the dental community and really provide that vital care at a very difficult time. Beyond that, I got a lot of calls from dentists in our organization that said they were getting calls from their friends who have their own practice saying, hey, what are you guys doing? How are you guys, how are you defining a dental emergency? How are you handling patients that need care? How are you getting PPE? We were an open book, trying to help because obviously we're all in this together. And I think there's other ways. Dr. Shalab and I have actually been part of a committee nationally that's been talking about should dental offices be doing COVID testing? Should dental offices be providing COVID vaccines over time? Is that something? So there are other things that we've been part of and that are kind of future oriented and things that we really take great responsibility to be that leading presence in the industry.
And I always think, you touched on it, the sign of a good leader is sharing those best practices. When you hold it too close to the vest, Priyanki taught me something early on, that sort of when you help the right hand, the left hand gets help as well. And to be able to talk about our best practices and share that information with other folks, that's the sign of a true leader. I do want to switch over and talk to Greg about the business of dentistry, which Jeff talked about a little bit. And 42 North Dental has continued to grow throughout 2020, mostly through the acquisition strategy. Talk to me a little bit about that acquisition strategy, and how have practice valuations changed as we enter into 2021?
Thanks, Matt. So we have continued to grow throughout 2020. We added a handful of practices towards the back end of the year. Certainly there was a period of time that we kind of took a step away from actually closing on the affiliations, as everyone was kind of bunkering down and getting through the pandemic, especially in the earlier stages. But to your point and to Jeff's point, and Priyanki's analogy of left hand washes right, we stayed in constant communications with the practices that we were talking with about potential affiliations in January and February. Our HR team and our clinical affairs team are putting out weekly and biweekly communications to our internal practices, and I was in turn relaying those to our potential future practices, ones that were considering joining the organization, just to keep them up to speed of, this is how we're handling things, this is what our doctors are seeing, this is what our employees are seeing. And our potential affiliates were using that information to relay to their team. Even though they weren't telling their teams that they were considering joining 42 North, we were at least giving them a bit of a playbook of how to try to best manage it as best you could. For the practices that have joined the organization over the last couple months, they kind of fall into two buckets. Some of them we've been in communications with for years. And certainly elevated levels of conversations prior to COVID really kind of hitting the fan in March. And also some that came about in the summer or so. So the ones prior to the storyline there was, everyone had kind of already gotten over the mental hurdle of, this is a partnership that we want to work on together. We were able to kind of navigate the finances and figure out the right valuation and structure. And then COVID hit and it threw a wrench in everything. And, our communications with them was, look, you stick with us, we'll stick with you. Let's get through the heart of this, and we'll be there together on the back end, and we'll make it all work. And we were able to support those practices, make sure that we were all able to come out the back end. And we didn't change deal structures or valuations. We didn't want to discount things because a global pandemic hit that's outside of everyone's control. Really, to us, the goal was always, let's just make sure that we're both coming out of this stronger and that we can join forces together and really make it a win for both sides, which has happened. The groups that approached us, kind of in the middle of the pandemic, we certainly got approached by a lot of groups that were just in very serious trouble and they were thinking about closing their doors and things of that nature. And we were able to steer them in other directions, but for the most part, our partnership model is not one of taking advantage of downtrodden opportunities or looking for those sorts of things, but it was really finding really great practices with really good clinical leaders, and they were doing the best they could. And in often cases, it was doing a great job of navigating through it, but they were kind of raising their hands saying, this is the time now more than ever that we can do this on our own, but it makes a lot more sense to have a partner to get through not only this, but whatever the world's going to look like when all the dust settles. It's something that we've been thinking about for the last couple of years, but this has kind of escalated our thinking of, is now the right time to do something instead of holding on to ownership, quote unquote, for the next 1 to 2 years. Maybe now is a great time to take advantage of a partnership. And similar concept from a valuation perspective, we were very upfront with them saying, you're today at this very moment, your practice is not worth what it was in January or February. But if you and we can all showcase that we're coming out of this strong on the back end, we'll honor what your practice looked like in 2019 or kind of where it was headed. And we'll be creative and make sure that you don't feel like you're getting discounted by joining us today as opposed to yesterday, or it makes sense to wait a year or two. We'd rather let's make the dollars work so that the partnership can get started sooner rather than later, and we can work together going forward.
I do hear you saying partnership a lot, which I think is a really important point here. And that idea that a selling doctor is partnering with a DSO and they're not just becoming an employee. Is that a little bit different with 42 North Dental than with some other DSOs? Is that a different structure?
Yeah, so our internal model is one of dentist ownership and partnership. So of the 80 plus offices we have over 250, 260 plus dentists in the organization. Over 100 of those are actually shareholders in 42 North Dental as a company. So those 100 plus people, they own a piece of the pie that is 42 North, not their individual practice. And the people that join us through affiliations almost always take a piece of the proceeds as form of ownership in 42 North. So, of the affiliations that we've done over the last month or two, there's some folks that have owned their practices that are in their early to mid 40s, and they're looking at this more of a long-term career partnership as opposed to take your chips off the table so you can retire. There's people on the other end of the spectrum that are 2 to 3 years away from retirement. They're still becoming equity owners because they're not walking away and handing us the keys. We're getting through this together, and we're going to set the practice up for the next generation of clinical leadership. But they're not looking to leave in the next couple of years. So we want to make sure that we're partners with them, and they likewise are partners with us, and we're doing this together.
And Jeff, with that being said, do you think that we're going to see an accelerated shift in single practice dentists joining DSOs based on what Greg just talked about?
Absolutely. We've seen a bit of a wave already. I think Greg mentioned we've closed a number of affiliations recently. We have several more on the very near term horizon. I think at the end of the day, there are people that really want the challenge of being a great dentist and being a great business owner, a real entrepreneur. And there are people that relish the fact that they have 2 full-time jobs because that's essentially what that is, a business owner and a dentist. I think there will always be people that relish that opportunity, but it's getting tougher and tougher. The demands, the constant regulatory changes, the reimbursement outlook, from dental insurance companies, costs are increasing. When I look at our organization, we have almost 100 people working out of our home office in Waltham, just supporting the offices. Obviously, Matt and Kirsten on the phone are part of our marketing team, and a growing marketing team with other folks, great folks on the team. We have an HR team and a payroll team and an IT team and an operations team. And I think it takes a lot of time to do all those things and to do all those things well. And I think we are even seeing some folks that are saying, I was thinking maybe it would be time to think about transitioning my practice 2 years or 4 years from now. Some of those folks are speeding that up, saying, hey, maybe I should just do it now. And in an organization like ours, I can continue to run my practice and have equity in this growing company, which is attractive. But we're also seeing, as Greg mentioned, some practice owners that are 40 and have 25 or 30 years left, and they're choosing to be part of an organization like ours because of how time consuming those things are and the value that they believe we can add in terms of our marketing to help drive new patients and reactivate patients, our HR support, whether it's recruiting or working through benefits. There's just a lot of things that we can do to help and really add value to the practices. And then the final point on that equity ownership, I think there's also folks that realize that if you're a dentist owner and you own a practice and you really want to grow the value of your equity, you really have to significantly grow your own practice, and people can do that. You can work more yourself. You can bring on another dentist and expand but it's a lot of hard work to get there, and to think about doubling or tripling the value of your equity in your practice over a 5 or 10 year period is it's not impossible, but it's very difficult, and it's certainly hard to, at some point, if you double it in 5 years, you're not going to double it again in the next 5 years. And that's really been our trajectory. We've been able to double and triple the value of people's equity investment over a 5-year period. So it's a very lucrative investment because people own part of something that's growing. So our 100+ dentist owners that Greg mentioned earlier essentially own right now part of 81 dental practices. And when we close our next affiliations and open our next de novo, they're going to own part of 82 and 83 and 84. And so you see the value of their equity really increasing, which is very attractive as well.
And Greg, do you think that the equity that Jeff's talking about and building that, is that what makes it worthwhile for, let's say, a doctor who really rolled up their sleeves, who feels they have a really strong business, was really focused, and feels like they've been able to manage through the pandemic well? Is it that equity that really makes it worthwhile in joining a DSO?
It's a combination of the equity, but it's also kind of a realization that there is genuine benefit of being part of a larger group as opposed to going it alone. As Jeff mentioned, it's some people relish being both a full-time dentist and a full-time business owner, and that the definitions of what that means is now very different than it was 10, 12 months ago. Dentists over the last 9, 10 months had to do everything that Kirsten talked about in terms of communicating with patients, both immediate patients that with appointments scheduled, mid-treatment patients, plus emergency cases that come up when your office is closed. How do you reroute those calls? They have to deal with all of the clinical issues that Dr. Shalaba talked about. They have to deal with all of the staffing issues and the HR issues of employees that now have all of these challenges on their plates. From health issues, from personal issues, that Priyanki and the HR team have handled. And by the way, they also have to be a full-time dentist and manage the practice finances where, but let's be real, they just lost a whole lot of money. Now they've got to figure out how to navigate all of this PPP loan stuff and all of the banking issues that come across with that. It's very difficult to navigate all of that by yourself. And even for the ones that were very successful in doing it, that took a lot of effort and a lot of work. And while no one's predicting that another COVID type situation is going to happen over the next couple of years, and you obviously don't want to live your life expecting the absolute catastrophic worst, there is a lot of value that people are quickly realizing, for whatever the case may be, whether it's, in a small, medium, or large scale issue that arises, maybe there is benefit to all these groups out there. And as DSOs over time have continued to evolve, and we use the word partnership a lot because we do more than just own practices. We truly partner with and support our practices. There's more to it than just selling your practice to us and getting a check and becoming a 9-to-5 dentist. There's a whole host of other things that we do for our patients, for our people, that is a true benefit to a practice owner being part of the organization.
And what I'm really hearing between, Greg, what you're saying, what Jeff is saying, is that dentist owners sort of always knew why a DSO was good and understand what DSOs do, but it's coming to fruition at this point, seeing as we've gotten something that's sort of catastrophic, and there may not be something as big in the future, but there may be other things along the way where they're really going to need to lean on a support organization in the future to continue their business. Priyanki, I did want to touch on, Greg just talked about staffing, which is a huge issue in the dental industry right now. And I'm sorry to keep you waiting for so long until we got to that part of it, but you're out there every single day talking to dentists and dental staff. How has that candidate pool either adjusted their vision or their view of a DSO? And what are you hearing from them?
Yeah, I mean, Matt, I was going to say, so kind of piggybacking off of what Jeff, Greg, and Dr. Shalaba have mentioned, correct. I've heard from many experienced dentists, either practice owners or associates in practices. One of their biggest concerns is just not having enough or proper PPEs. So they've just genuinely been really afraid to go back into work and have kind of just been mortified about that. And then you're right. So staffing has always been a big challenge in dental practices. What I've realized during this pandemic is it's now more so than ever, simply because a lot of the staff from a dental practice, number one, they either just didn't feel comfortable coming back to work, or a lot of them are just, you know, people that have young children at home that are in remote schooling, and they just didn't have the coverage for someone to watch their kids while they were at school. So because of that, it's been a huge challenge. But Matt, you know, we're here, we're a great team, and it's nice to work with a really nice team of recruiters that are very experienced and great at what they do, and they all work really hard to make sure that our practices are trying to be as staffed as much as possible. So over the past few months, we've kind of retweaked our strategies, but it's been working really well, Matt.
And you talked about a team of recruiters. Is that something that a DSO does differently with potential employees? And, you know, I'm trying to think about, it all sounds so overwhelming with all the individual pieces, but because within 42 North or DSOs, there's real subject area experts in each one of them. So is that team of recruiters, and is there other things that a DSO offers potential and current employees versus a single doctor practice?
Yeah, I mean, Matt, you did explain that or ask that well. Basically, you're right. We definitely have a team of experienced recruiters. They're all basically trained to go out and find the right talent for our practices, find the experienced assistants, hygienists, or even dentists and specialists or front desk staff as well for the practices. So that's kind of what they do, and it's good. The best thing, by the way, Matt, is that our dentists, our dental directors really get the say in that. So we have a team of experienced recruiters. What they'll do is they'll be able to present the candidates to the hiring manager, so to the practice manager, to the directors of these practices, and we allow them to make that decision. And, you know, our jobs really are to make sure that we give them as much qualified talent as possible. So,
and that's really got to cut down on the workload for them when it comes to those pieces, because you're sending qualified candidates over to them. They don't have to literally flip through resumes and do the job postings online. And that, I think that's a real benefit of having a partner behind you. Absolutely. You know, Priyanka, you did talk about staffing coming back with childcare, PPE, lots and lots of challenges about getting people to return to work. So Kirsten, tell me about the employee communication over the past 9 months. How were employees specifically in the field made to feel safe about continuing to work or returning to work? And how do you support that ongoing?
Yeah, absolutely. You know, as I was listening to Priyanka, a lot of the concerns that prospective employees have are the same ones that we're all dealing with: remote school, our own health risk profiles, our own issues, and our own risk level of how we think about COVID and how our households are set up. So we're all dealing with that. So I think I can talk about it from a couple different ways. You know, as the pandemic has unfolded, you know, one of the things we do with our current employees is the same thing we do with patients. It's about empathy and understanding and working together for good outcomes. And so, you know, we spend a lot of time talking to our employees about their own health. Mental health as well as physical health. So, for example, we have an employee assistance program that was available for free to all of our employees and their families to help them with legal issues and health issues and mental health issues and like that. We also focused on remote work and what that looks like and how to do that well and how to be successful in this new working environment. We spend a lot of time on collaboration and how do we, in a remote environment, how do we get folks to support each other. And I think that's a part of it as well. And then one of the benefits of being in a DSO with so many different practices is that we can really work with individual employees to try to find a job that will work with their situation. So, we move people around. We were able to move hours around. Our practices are open convenience hours for patients. So we can craft hours to fit what your unique situation is. So we were able to keep more people at work and happy than I think could have been otherwise possible. So really proud of that and communicating that.
Yankee, is that a benefit that Kirsten just talked about essentially saying, we know you want to be in the dental industry, your current position and your current role isn't working for you right now, but you're a great hygienist, you're a great doctor, you're a great specialist, we'll find a place for you. Is that something that the candidate pool is responding to?
Absolutely, yes. I mean, Matt, you know, as you know, we have over 80 plus practices. We have practices all across New England. So it does work well. It's good because a lot of the candidates that are looking for a specific position and maybe just one private practice, they might not end up getting hired for various reasons. Then they end up trying to find another private practice or whatnot. But when they come to a DSO, you have many, many different options. So along with our directors being able to make that hiring decision, also our candidates get to make that decision as to where they want to go, where they feel comfortable, and really get to make that decision on their end as to where they want to work. So I think it works phenomenally. Yes.
And are you still seeing a high demand for dental industry jobs as you're out there? People still want to work in dental practices?
Yeah, Matt, I was personally very surprised and very shocked over the past few months. I really thought that things would slow down, but they haven't. And specifically, I'm talking about all the DSOs. So the DSOs are continuing to hire companies like ours, like 42 North. I mean, we're still acquiring practices. We are still growing. And the need for us to hire is absolutely there because of our growth strategies. Yes.
And I hear that demand is there. And as we roll into the last 10 minutes of this, Kirsten, let's talk about patients and patient demands. Is the demand there, and do patients want to come in for dental care today?
Matt, as you know, since you work in marketing with me, they absolutely do. I was actually had a lot of trepidation as we started to reopen our practices. I really worry all the time about making sure all of our doctors and hygienists' schedules are full. That's a big part of my job. And so, you know, I was very surprised at how quickly we were able to rebuild our patient demand and get our doctors' schedules full. I think some of that was just folks who had waited. Either they missed we had a lot of appointments to reschedule, or people who had small problems that they put off that now are becoming bigger problems. Some of it, I believe, was the incredible relationships we have with our patients and how much they trust us and trust our doctors. At the end of the day, patients have relationships with their practitioners, with their doctors, with their hygienists, and they trust them immensely. So as we really pushed our health and safety information, we did a statewide campaign around health and safety, really profiling how our doctors are approaching care, what they're doing, why we feel it's really safe to come back, why we think it's really important to your overall health, especially right now, to get that care. And patients listen to us because they believe in us and they trust our doctors. We have very high quality care at all of our practices. We have award-winning doctors across the board, so that really helped. And then we also did pick up a lot of new patients who, their practice either wasn't open the same number of hours, or they were missing hygienists, and so you couldn't get that kind of care. Most of us know that the hygienist is an area where a lot of folks are hiring. So we did pick up an awful lot of new patients. In fact, our new patient numbers are looking pretty good in the fall.
And you talked a lot about, and it's all really good information, to hear about patient demand. And you talked a little bit about making patients feel comfortable. And for anyone that's watching, if you head to 42northdental.com, there's a health and safety section that talks about how we're keeping our people, our practices, and our patients safe during the pandemic. So there could be a little bit of information there that you can glean from. But Kirsten, specifically to patients, how are we telling them and reassuring them that they will be safe receiving dental care? Because even myself being in the industry, it was a little bit daunting to head back into a dental practice.
Right. Well, we're using all of our different channels, not only our patient communication channels, but we have a whole team of digital experts. And, for those of you who are waiting your next Amazon package, you know that a lot of our life has really moved online. And we're taking advantage of all those different channels to reach people. It's also becoming more competitive online. More people are spending more money. So we've had to be really smart about how we use those different channels. But that's a big part of it. It's just the ongoing communication and really continuing to reassure. We also do training of our front desk, so they know how to answer questions. And I think one of the biggest values that I see around that health and safety is something that was alluded to earlier, is that we have, we have people who are looking in each state at what the latest information is. What is the CDC saying? What is the ADA saying? What are the state boards of health saying? And translating all of that information into usable information and guidance for the practices and for ourselves. And as you remember from back in March and April, I think Dr. Shalaba said it was the Wild West. But if you remember, every single day there was different information out there, and trying to sort through that so that you would know what to do. Well, we remain committed to that. So we spend a lot of time translating that information into usable information for our practices and our people. And as we go into this vaccine rollout and this vaccine deployment, we're doing the same thing, for our staff and for our patients to understand what that means to them.
Dr. Shalaba, what does the research show about receiving dental care? And in your professional opinion, is it safe to visit the dentist? And how are we telling patients about that?
Yeah, Matt, it's absolutely safe. The key here is, once again, the PPE. Dentists, hygienists, dental assistants wearing an N95, wearing a face shield and a gown. It's high-speed suction. It's absolutely safe. The CDC says it's been safe. There's been journal articles written that the infection rate of dental healthcare workers is extremely low as compared to other healthcare workers, and also the general population. And part of that's because dentistry has been utilizing universal precautions for 30 years. And it's the standard, it's what we do. And increasing the level of the universal precaution by changing to an N95 mask versus a level 3 was a minor change for the dental industry. It was just, it's a different mask. We got used to it, and we're going ahead and helping patients that need our care. There's no doubt that that is a question that's been asked over and over again, and the research absolutely, and the experience that we've had absolutely shows it's safe.
And I think it's important for us as an industry to continue to reiterate that to patients and to colleagues as well, that it is safe to visit the dental practices. And oftentimes the risk of not visiting the dentist are greater than the risk of possibly contracting the virus in a practice. Absolutely.
Kirsten talked about patients, the backlog of patients not being seen for routine care, and that's led to absolutely increase in periodontal disease. And we've seen that by looking at our metrics. We've seen an increase of decay, and those things are essential to patients' health. A cavity that's left untreated over a long period of time is going to lead to a root canal or possible a tooth that's failed. So that needs to be extracted. So these are things that have long-term impacts to individual people's health, that dentistry is absolutely essential. Dentistry is safe. And we are absolutely happy to be there for our patients.
Jeff, as we go into the last few minutes here,
Matt?
Yes, Kirsten.
Oh, I was just going to jump in and say, we've kind of moved from real health and safety communication to really talking about exactly that, the impact of good dental care on systemic health, and a sense of urgency of taking care of those problems that you may have left behind. And one of the things about 42 North Dental is we really believe in marketing and communication, and we spend money and time on it. And I believe that a lot of the advertising that we're doing out there is going to help the industry as a whole in our states and in our communities as we educate patients about the importance of getting back to see their dentist.
I think putting a spotlight on that is a real benefit for the entire industry, especially coming from a leader in the DSO field like 42 North. So Jeff, all of this being said, it's actually a perfect segue. What would you say to someone, a dental professional today working in the field, about joining a DSO, and why is now the time to do it?
So I'm somebody who likes to know my audience, and I guess I would say if the audience is a young dentist trying to kind of think about the career in front of them, I would say think about the benefits of joining an organization like ours, where you have real clinical and leadership development opportunities. Dr. Shalaba and our clinical management team establishing continuing education programs, mentoring programs, real networking opportunities with a group of like-minded dentists, I think is very attractive. For somebody who's maybe a little more experienced and is thinking about, do I want to join an organization like this, or do I want to go buy a practice, or maybe I have a practice. Do I want to still be the owner of the practice, or join forces with someone like 42 North? I think for someone like that, it may be different. Maybe they feel like they've developed the clinical skills. I know Dr. Shalaba would say, and I totally agree, that everybody should be looking to continue to refine their craft and become even better clinically, whether that's expanding the range of services they provide or just getting better at the things that they do. But having a peer network, a group of people that you come together with to share best practices, and other people that are leading practices to say, how are you doing things in your practice? Or, why is your patient retention rate so high? How did you do that? Like, what's the secret to success there? I think having that peer network and the opportunity to share best practices with others is a powerful thing, and also to learn from others is very powerful. And then even for a specialist, I think you're a specialist thinking about where do I want to go? Do I want to go buy into or work at a specialty practice and go with sort of more the traditional referral stream as the industry changes a bit? Or do I want to go work at 15 or 20 different independent practices, or go be part of an organization like 42 North that can really provide my own dedicated assistance in all the practices that I work in, and real consistency around how the referrals happen, and the opportunity to really train and educate. So I think it probably depends on the person who is on the other side of the conversation, but I think there's benefits for any dentist, and we already talked about the benefits for staff members to be part of a large growing organization. There's a lot of promotion opportunities. There's opportunities to make sure you have full-time work if that's what you're looking for. So I think there's benefits as well as those continuing education opportunities for dental staff as well.
And Greg, in 30 seconds.
I'm sorry.
Yes, go ahead.
I'm going to jump in on there 1 second. One thing that Jeff had mentioned is that support structure that's there. I can't tell you how often during the last 9 months that we were able to have one of our doctors who was working in an emergency hub talk to a doctor who hadn't practiced yet, and talk to them about their experience and what it's like to wear the PPE and what the protocols are, and having to be able to have that support structure to talk someone through what they're doing is a lot different than giving them a list of protocols to follow and tell them to do it on their own. And that support structure was imperative to our success. It happens on a daily basis now when there's an encounter with an employee or a patient who subsequently says, oh, I tested COVID positive, was in the practice 2-3 days ago, and how you navigate the protocols to notify the rest of the staff or to determine who quarantines, who doesn't, and be able to have that support structure there without having an individual having to make the call on their own is priceless.
I think that partnership and that someone really having your back, and there's a difference between understanding information and interpreting information as well. It's sort of that learning or that listening versus hearing kind of mentality. And Greg, just a simple yes, no, because we're running up on time. Are all these statements resonating with dentist owners in the market as you're out there?
We don't get one word answer, but yes, essentially yes. Everyone that's ever affiliated with a DSO, same rings true with 42 North. Their reasons are all different. There's not a basic 3-question, yes, no checklist for a practice owner to read through and figure out whether joining 42 North makes sense or not. Everyone has different reasons and different priorities for their motivating factors, but everything that we've all just talked about and all the different divisions and things that are of consideration, all of those have led more and more people to really rethink their strategy of being a business owner on their own, or the benefits of joining a group like 42 North.
And I think joining a nimble group is important. 42 North, I know, is a leader in New England, but also I know the team really prides themselves on being nimble and being able to pivot. So Jeff, before we wrap up and we sign off here today, I think maybe the most important piece of advice that you can give is, what can a dentist owner do today to ensure that their practice is successful in the future?
So I'd say, as a dentist owner, if you want to go it alone and continue to be an independent practice owner, I think you have to find a way to commit to and measure and hold yourself accountable for quality dentistry and a great patient experience. And I think everybody says we do great dentistry and our patients love us. I haven't met a lot of dentists that don't make those statements, but really finding a way to measure it, because if you don't measure it, it's hard to really say. And obviously there's no standard metrics used in the industry. So develop your own metrics, hold yourself and your team accountable to really define what is quality and how do we make sure we're providing it, and what is the great patient experience and how do we know that we're living up to it. And then, I'd say make sure that you've planned your future. If you're a dentist owner and you want to own your practice for 10, 20, 30, 40 years, try to plan out what that's going to look like over time, and have a plan. And if your plan is potentially think about a DSO, be very careful, be very selective, choose a great partner, and find an organization that really fits what you're looking for and really adds value to you as a practicing dentist, as a practice leader, and find the right DSO that's going to fit your profile.
That's all great information. I think we've really heard about the power of partnership here today and how that's so important to navigate a pandemic and really during normal times as well. So thank you to everyone who took time out of their busy schedule to join this panel today. It was really insightful to hear from every one of you and your subject area expertise. And thank you to everyone that watched today. For more information about 42 North Dental, you can visit our website, 42northdental.com. The information for everyone who's on this panel is on that website as well. And enjoy the rest of Yankee Dental 2021.
Thank you.